you a high five first. I'd like to start this off by asking you all a question. How many people here do not have a pink dot on your driver's license? Do not. Do not. Not many. Okay, perfect. Then this talk is just for you. Now I can assume that the rest of you do have a pink dot on your driver's license. And if that were true, then this talk would be just for you also. However, is there anybody out there that has no idea what that pink dot on your driver's license really means? Anybody? Quite a few. Perfect. Because this talk is just for you. As a matter of fact, that's the name of this talk. What does that pink dot on your driver's license really mean? So let me set the stage. You're with your friends and your cell phone goes off, like it does how many times a day? You look down to see that it's an actual phone call from a number that you do not recognize. You answer it, and the voice on the other end is telling you there's been a terrible accident, and that you should come to the hospital as soon as you can. You hang up, and everything that mattered to you that day changes, and you rush to the hospital. When you arrive, the person at the front desk is telling you that your loved one has been admitted to the intensive care unit, or ICU, and shows you the way. When you get up to the ICU, you walk into a room and find your loved one lying in bed. There's a blanket pulled up to their chin. You can see their chest slowly rise and fall. All around there are wires, tubes and hoses coming out from underneath the blanket. Above it all, there's a softly beeping screen with a bunch of lines and numbers in all different colors. When you meet with a doctor, they tell you that in the accident there was severe trauma to the head, and that despite their best efforts, they couldn't stop the swelling in the brain, and that your loved one has been declared brain dead. They tell you that there are other people here to discuss end-of-life decisions with you, and the next people that walk into the room are introduced as being from the donor network. And they sit down, and after checking in with you, making sure that you knew exactly what happened, and that you understood everything the doctor said about brain death, they ask you this question. Were you aware that your loved one signed up on the donor registry? So then what would you say? Now your response to this question is so important to me because my job is to be one of those people to walk in that room to ask you that question. My name is Mike Higuera. I have been a critical care nurse since 2000, but for the last 11 years I've been working as a transplant coordinator for the donor network. And before we walk into that room to speak with families about donation, many things have already happened. The first is that the hospital has made the referral. Every hospital in America is associated with an organ procurement organization, or OPO. There are 58 that cover North America. There are 4 in California, and they are all nonprofit organizations. Whenever a patient comes into any hospital with an injury that causes a certain degree of neurological deficit, that hospital refers that patient to their local OPO. At that time, the OPO checks their individual state's donor registry to determine if that patient had signed up. And if so, the document of gift is attached to the chart. This is also called a first-person authorization. If this hospital happens to be in my area, then I or one of my colleagues are dispatched to head on site for a patient assessment and chart review. The goal of the chart review is to determine the course of events, a past medical history, or any disease process that would make organ donation not possible. For the neurological assessment is to determine the presence or absence of the brainstem reflexes. So there's the brainstem. It's the most primal part of our brain. It functions to keep us alive on the most basic levels. It's in charge of our blink to keep our eyes moist and protected. It controls the size of our pupils so we can continue to see in varying degrees of light. It makes us cough to keep our airway clear and not choke. Our gag reflex so we can purge any ingested toxins. It helps us move quicker to environmental stimuli so we can do things like not catch on fire. It's the reason for the very breath we take. And the absence of these reflexes is an indication that the blood flow to the brain is stopped. And so in my assessment, if I find that these reflexes are absent, then the patient is determined to be areflexive. And a plan is made with a hospital to determine timeframes for formal brain death declarations. In the state of California, 2 separate physicians are required to declare brain death. Less than 1% of the population of the patients admitted to the hospital ever meet the criteria to be declared brain dead. So this is very rare. In order for a doctor to declare brain death, the patient must meet certain criteria. They must be areflexic. They must be warm because being cold can mask the loss of reflexes. If any medicines were given to depress their central nervous system, then enough time will need to have passed to make that clear their system. And they must have certain labs within normal limits. If the physician finds that the patient is areflexic, then the Brainstem exam consists of, the Brainstem exam would consist of shining a light on the pupils to determine if there's any pupillary reaction. A cotton swab is touched to the surface of the eye to check for any blink reflex. The breathing tube is used to determine if there's any cough or gag. The ventilator on the frequency on the ventilator is momentarily turned to 0 to check for any spontaneous respirations. And the hands and feet are stimulated to check for any movement. If all of these are absent, if the physician finds that any one of these reflexes remain intact, no matter how slight, then the patient cannot be declared brain dead at this time. Brain death can only be declared if all reflexes are absent. Anybody considered to be in a coma has maintained at least one or more of these brainstem reflexes. But if the physician assesses the patient and determines them to be areflexic, then then a confirmatory test will be done. Some of the confirmatory tests are the EEG, which checks for the electrical activity of the brain, the cerebral blood flow study, which actually monitors the actual blood flow going to the brain. But the most common confirmatory test is the apnea test, meaning literally without breath. If we hold our breath long enough, the stimulus to take the urge to take that breath again actually comes from the rising levels of CO2 or carbon dioxide in our blood, and not from the lower level of oxygen. For the apnea test, a blood sample is drawn to determine the level of CO2, normal level being 35 to 45. Once that has been established, the ventilator is disconnected from the breathing tube and the patient is assessed for any spontaneous respirations. If any spontaneous respirations were noted during this time, then the test is over and the patient cannot be declared brain dead at this time. However, if after 8 to 10 minutes the patient remains stable and no spontaneous respirations were noted, then a second blood sample is drawn and the patient is reconnected back to the ventilator. If the CO2 level on this second blood sample is above 60 and the patient has not been seen to take any breaths, then that means the patient will not initiate any breath ever. And this confirms brain death. A second physician will be called in to do their assessment, and if they find the patient to be areflexic, then the time of their written brain death note is the legal time of death. At this point, the families are gathered by the doctors to discuss their findings and to answer any questions they may have about brain death. It is only if this family is accepting of the diagnosis of brain death are we then brought in to have this donation discussion with the family. Now this part of my job is the hardest and the most rewarding. It's the most rewarding part because when I walk into this room to hear what this family has to say when we ask, were you aware that your loved one signed up on the donor registry? And they say, yes, we were aware. And they say how this decision was made because of who the patient was in life, how giving, how generous they were. They say what a comfort it is to know that something good can come from this tragedy. They show me pictures, they tell me stories about who they were in life. Witnessing the generosity of human beings in acute grief is truly humbling. And in working with this family for the next day or two, obtaining the medical and social history, and the evaluation of the organs, and the placement of the organs with recipients, and the eventual organ recovery, and being the one to show this family that their loved one is being treated with the utmost dignity and respect is truly an honor. It is the hardest part of my job because when I walk into that room to hear what this family has to say and they say, no, we weren't aware of that. And how would you know and not me? And they ask, is that why they didn't do surgery? And they say, what do you mean I don't have a choice? I don't believe you. Being the cause of further anguish to an already grieving family is a very difficult position to be in. But in my experience, these dissenting families are just in need of time and information. So what does it really mean to be signed up on the donor registry? In the state of California, almost 13 million people have signed up on the registry. I thought it would be 13 million today, and you guys would be the first to know, but not yet. Almost 13 million people are signed up. That's 1 in 3 Californians. Over 95% of that almost 13 million had signed up at the DMV. which means that after waiting in line while getting your driver's license or identification card, one of the questions that you were asked is, would you like to sign up to donate your organs, eyes, and tissues? So what does that mean? That means you have the potential to save 8 lives by donating your heart, both lungs, liver, 2 kidneys, pancreas, and an intestine. You can also help save someone's sight by donating your cornea, which is the lens right below the surface of the eye. And the tissues commonly recovered for transplantation are the bone, the skin, the heart valves, and the blood vessels, thus enhancing another 50 people's lives. So if you said, yeah, that sounds good, you get a pink dot on your driver's license. Or you can say, no, not at this time. But in my experience, these dissenting families are just in need of time and information. So what does it really mean to be signed up on the donor registry? In the state of California, almost 13 million people have signed up on the registry. I thought it would be 13 million today, and you guys would be the first to know, but not yet. Almost 13 million people are signed up. That's 1 in 3 Californians. Over 95% of that almost 13 million had signed up at the DMV, which means that after waiting in line while getting your driver's license or identification card, one of the questions that you were asked is, would you like to sign up to donate your organs, eyes, and tissues? So what does that mean? That means you have the potential to save 8 lives by donating your heart, both lungs, liver, 2 kidneys, pancreas, and an intestine. You can also help save someone's sight by donating your cornea, which is the lens right below the surface of the eye. And the tissues commonly recovered for transplantation are the bone, the skin, the heart valves, and the blood vessels, thus enhancing another 50 people's lives. So if you said, yeah, that sounds good, you get a pink dot on your driver's license. Or you can say, no, not at this time, and you don't. So what does that really mean? So if you don't have a pink dot on your driver's license, and your heart stops beating and you die, then your family will have to make the decision to donate your eyes and tissue. Or if you are that less than 1% in the hospital that gets declared brain dead, then your family will have the option to donate your organs, eyes, and tissues at that time. So what if you do? What if you do have that pink dot on your driver's license, and your heart stops beating, or you are declared brain dead in the hospital? What does that mean? This is a quote taken from the document of gift. This person documented their legally binding consent to donate organs, eyes, and tissues for transplantation, education, and research. A document of gift not revoked by the donor before death is irreversible and does not require the consent of any other person. So we have discussed donating your organs, eyes, and tissues for transplantation. However, what many people are not aware of is that if your organs or tissues cannot be used for transplantation, then they may be released for research. Now, research is approved by all the OPOs and deals primarily with moving forward the organ transplantation or medicine in general. Another really important thing to know is that having that pink dot on your driver's license is your decision of what happens to you after you die. And this decision does not require the consent of any other person. Now imagine this reality being presented to a family, a grieving family in an intensive care center. So what's the remedy? Information. This is the age of information. Instead of making this decision after waiting in line at the DMV or in the ICU, look up what it means to be an organ, eye, and tissue donor at any Donate Life website in the comfort of your own home, and discuss this with and talk about it with your family and friends. I'd like to leave you with a quote. So first, know that you can restrict your document of gift. You can also take yourself off the registry at any time. I know I have been witness firsthand of the power of donation, and could do a whole other TED Talk of why you should be a donor. But this is what I want to leave you with. This is a quote from Chris Berry, a transplant surgeon who did a TED Talk in New York in 2012. So this is what I leave you with. I would wish for all of you out there that before you make this very important decision, that you do so with thoughtful consideration in an appropriate environment with access to unbiased and accurate information. Be informed and inform the ones you love.